So today I'm going to show you how we've been using MRI in a way we've probably never thought about or heard about before. Not to look at tumors, not to look at injuries, but to track iron deficiency during pregnancy. It's working, okay. Some of you, I think maybe most of you, are very familiar with this story. A pregnant woman goes to the doctor, and the doctor says, look, you're anemic. Your blood work shows that your iron levels are way too low. I'm going to administer some iron supplements. And then by this point, everybody assumes that the problem is solved, okay? But here's a question almost no one asks. How do we know that the developing baby is okay? How do we know that the baby is getting enough iron? And the answer is that we don't. We don't really know what's going on in the baby or in the placenta. I study iron dynamics during pregnancy, and today I want to take you to a journey inside the womb to understand one of the most difficult problems during pregnancy, one of the challenges, which is iron absorption and iron transport from the mother to the fetus. Iron isn't just another nutrient. It is vital for oxygen delivery, brain development, organ formation, DNA synthesis, but on the other hand, iron can be very toxic to our cells. It generates free radicals. It can cause cellular death. And that is why we've been struggling with iron for years. The reason is that it is so tightly regulated in our body. Iron deficiency during pregnancy can lead to premature birth, IUGR, that means smaller fetuses, and even fetal death. And the implications of iron deficiency during pregnancy lingers on to the infant, the child, and later on into the adult. We see adults that suffered from iron deficiency during pregnancy as fetuses, and they have higher risk for cognitive impairments as adults. And what I want you to take from this talk today is that early intervention is the key. Once developmental damage occurs due to iron deficiency, it cannot be reversed after that. The WHO has published this tragedy around 2010. And they're saying that roughly 30% of all pregnant women worldwide suffer from iron deficiency. And this is the more conservative assumption. I would say this number is even closer to 50% of women. And they planned and they said that the goal is by 2025, they wanted to achieve a 50% reduction at the rate of anemia in women of reproductive age by 2025, which is just today, and this is clearly not working for them. We don't really get iron regulation, iron transport, or iron metabolism. And the reason is that we don't have enough tools to study iron. And this has been affecting millions of women and their babies worldwide. Think about it. It's like sending a package through a delivery service without ever confirming that it reached its destination. Okay? Maybe it got to the wrong address. Maybe it got lost along the way. Tracking is important. Now let me briefly explain the placenta. Okay? The placenta is the heart of this story. The placenta is what connects the mother to the fetus. You all had it as fetuses. You were born with it, okay? Even you guys. It belongs to the fetus. It is an amazing temporary organ that only exists during pregnancy, and it acts as an interface between the mother and the baby. It regulates nutrient, oxygen, and waste product from the mother to the fetus and the waste product from the fetus to the mother. It's not just a passive tissue. It makes decisions about what crosses to the fetus and what's not. And for years, for decades, scientists and doctors believe that the baby is this perfect parasite, that the fetus is this perfect parasite, that it will take whatever iron it needs, regardless of the maternal status. But today, there are new evidence that proves that maternal iron deficiency does affect the fetus. So we decided to tackle this problem using ultra-high field MRI. This is the ultra-high field MRI 15.2 Tesla that we have here in the Weizmann Institute. And you can see the differences between how most of our body looks like in the MRI that repels the magnetic field, as opposed to iron, which is very unique. Iron is paramagnetic. It augments the magnetic field around it, and that is detectable using the MRI. And one more thing. Remember, MRI is a safe technique for imaging during pregnancy. So this is a great go-to method for iron deficiency during pregnancy. So let me show you how we are able to visualize iron using the MRI. So this is an image of a hemochromatosis patient, and these patients are suffering from a condition that makes them to store more iron than they usually would, and they have iron overload, as opposed to a healthy individual with normal liver. And you can see how dark the contrast is in the liver of this patient. So again, dark, that means more iron accumulated in the tissue. This leads me to our main goal. Our main goal is to develop a non-invasive MRI approach for studying iron transport during pregnancy. And we're not just talking about detecting iron levels in each tissue. We're talking about understanding the whole picture, understanding the iron dynamics. What's going on if the woman is deficient? What's going on when we administer supplements? What's going on if it's way too iron, if it's iron overload? We wanted to use this tool in order to understand iron dynamics during pregnancy. Okay, so before we delve into what I really want to show you, I just want to orient you first for the people who are not really familiar with mice. So this is an abdomen, both are abdomen of a pregnant mouse, and usually people orient themselves once I show them the eye of one of the fetuses. So this is an eye of one of the fetuses. You can see brain, spine, heart, liver, placenta. Each one of those fetuses has its own placenta, very much like humans, okay? And we also can see the maternal liver on both sides. And when we scanned these mice, we immediately saw that the deficiency group suffers from anemia. You can see the difference in contrast between this fetal liver as opposed to the deficient one. So we were able to visualize anemia. We were able to visualize iron deficiency and to understand that deficiency in the mother does really affect the fetuses. And I've been talking about liver. I don't know if I said it before, but liver is where we store our iron, okay? That is why liver is so important. This is our iron storage place. Okay, we did something else. We also induced iron overload, and we did it by administering IV supplements, and then we tracked what's going on in the supplement, and 5 days post-injection, we could see that a quick darkening of the maternal liver, and we were able to track where the supplements go 5 days post-injection. So we were also able to track supplementation. So what I've shown you isn't just pretty pictures. Of course, each voxel in those images is a number, and we could quantitatively analyze those images, and by that we could even detect subtle changes. So just as an example, how an MRI analysis would look like, you can see the clear significant difference between control and deficiency, and that is how we image and we analyze iron deficiency in those fetuses. On the top of the MRI experiment that we were doing, we also added some protein analysis. Okay, in our protein analysis, we've discovered that the placenta is doing something rather unexpected. It prioritizes itself. When iron levels become scarce during pregnancy, the placenta protects its iron reservoir on the account of the mother and the baby. It takes whatever it needs from the mother and doesn't share it with the baby. And I want to show you how we've seen it. Okay, so think of the placenta as a room, okay, that has two doors, an entrance door and an exit door. And usually what's going on is that through the entrance door that is facing the mother, okay, the entrance door is facing the mother and the exit door is facing the fetus. Through the exit door, we have iron coming in from the mother. And usually what happens is that the exit door will be open and then the iron will be shared with the baby. But that's not the case. When iron levels begin to drop, what the placenta is doing, it shuts the exit door towards the fetus, and then it stores iron in ferritin safes inside the placenta, okay? So this is not random, okay? If you think about the biological sense behind it, it's like flight attendants that tells you to put your oxygen mask first before you're helping others. The placenta aspired to make the pregnancy survive, right? That is why it protects itself even before sharing with the baby. Okay, so to conclude this talk, so we saw that the placenta is a very clever decision that a very clever tissue that can make decisions, and it prioritizes its own iron needs during deficiency. We saw that we established this first non-invasive, non-radiating visualization of iron during pregnancy, this new method, and we also were able to track supplementation. And we believe that this potential breakthrough in understanding iron metabolism could lead to new targeted iron treatments, because for once, we'll not be making educated guess about the baby. We'll have a new method to really assess and diagnose what's going on in the fetus. Thank you.